Okay, so John, what was your experience when you first created the BioBlock and tried to introduce it to the orthodontic to your peers and colleagues in the orthodontic community?
Well, when I tried to first introduce my concepts and thoughts, it was completely rejected. And I was treated as a crank and even a crook. And in many eyes, I am still totally rejected. But that is because I was suggesting that you can alter the way the face grows and you can make it grow forward as it should do if you correct the oral posture. That is a premise that is still, I'm afraid, almost entirely rejected by the orthodontists. They feel it is quicker and easier to use mechanics. And certainly it is very difficult to change the shape of the bones and the growth of the bones by changing oral posture. But I'm sure that is the only way it can be done.
I've seen a lot of reversal cases uh, that you've done, where a kid has prior retraction and then their face starts to grow forward with BioBlock. Do you still do a lot of reversal cases?
Um, we get patients in who have been both damaged by orthodontics and damaged by poor posture. I think the original cause is poor posture, but it can cause quite major distortions of the face. And correction, by any means, is very often going to make it partly worse, partly better. But the orthodontists, of course, concentrate on the teeth, whereas we, by and large, concentrate on correcting growth by means of correcting posture.
How did you come up with the BioBlock? What when was the moment where you had that realization that this is something different to do and better?
Well, when I first realized that the Biobloc had to be right was when I first found or first developed the appliance which actually trains the patient to keep their mouth shut. Because the first few patients who I trained had dramatic changes to their face. And basically, no one, I think, had ever done this before.
What year was
And
that?
that made me realize that it was a far more powerful tool than I had ever imagined. Orthodontists, by and large, are convinced you cannot make the lower jaw grow forward. Therefore, if the teeth are sticking out, there's only one thing you can do, and that is pull them back. But the early work I did with these Biobloc appliances showed me that you can, in fact, make faces grow a long way forward, and you have seen the photographic evidence of that. And the main reason why Biobloc orthotropics is accepted now is because of the clear evidence of the forward growth we can create. And currently, there is no other treatment I have seen that is able to achieve that.
What year was it when you came up with it?
I miss that?
What in what year did you first come up with it?
No. I would think I first came up with the tropic premise that was the basis of orthotropics in the late 60s. I developed that technique of keeping the mouth shut in the mid to late 70s. And after that, I was absolutely convinced that there was no other treatment that could possibly work. I'm not saying Biobloc is the best. I'm saying that changing posture is the only way.
How did you try and educate orthodontists about your premise and your appliance?
It's very difficult because orthodontists are really only interested in the teeth. Time and time again, they will look at the teeth rather than looking at the face. However, the patients and indeed the public as a whole are far more interested in the appearance of the face. It is relatively easy to get straight teeth mechanically if you put train tracks on all the teeth and wires in between them and lock them up. But the evidence shows very, very clearly muscular back. But the difficulty I had is because orthodontics is a huge and very established part of the environment, and I was introducing a completely different and very difficult and exceedingly time-consuming. Remember, if you're guiding growth, you're into treatment for 4, 5, 6, sometimes 7, 8 years, whereas orthodontists never go much over 18 months to 2 years.
Tell us a story of how you succeeded in getting your appliance into the mainstream and getting it accepted, and what sort of, I guess, challenges you had along the way.
I think the single biggest influence as far as our success has been is the faces we have treated and demonstrated, because they are clearly much better than any other treatment. However, I have also done a huge amount of research, and I have had a number of papers published which very clearly show that orthotropics get much better results. I did a series of identical twins where all the cases that are being treated by orthodontics look worse. Every single one of the cases look worse at the end of treatment than before, although their teeth were beautifully straight. I then did a comparison of their identical twin treated with orthotropics, and they had dramatic improvement. So the evidence is overwhelming. I've done big studies where we took the best cases treated by orthotropics and compared them with the best cases treated by orthodontics. And there was a highly significant difference between the two. There is huge evidence. The problem is that very little of it is published in England, a certain amount in America, and most of it is published abroad. I've had to have papers by languages just in order to get them published.
Why is that?
Well, because they are ingrained with years of practice. But essentially, what Michael was saying earlier, they do not appreciate how far we are from the human norm. We are grossly distorted, you and I. Our faces should not look remotely like they do, and it's because our maxillae have dropped down and back. We should have both our top jaws should be, as I said earlier, 20, maybe 25 millimeters further forward. We would look entirely different. We would have absolutely no ear, nose, and throat problems, absolutely no sleep apnea, and we would have perfectly straight teeth.
I guess more what I'm getting at is why did you have to publish in different languages to get your papers out there?
Because it's taken me so long. Several of the papers that have eventually been published, I've had to send to different journals over a period of 15, 20 years. One paper, which I know is widely accepted now, took me 25 years. I never altered the paper, but this is the same for anybody, I think, in any field, introducing new methods. As Machiavelli said many, many years ago, it is very difficult to introduce a new method because all those with an interest in the status quo will criticize it, and there are very few people who are going to benefit from something as yet unforetold.
Anything you want parents to know today about their kids' oral health and health in general?
I think that a lack of forward growth of the face has a huge impact on general health, because airway is crucial for lung health, as well as the ear, nose, and throat problems. If your face grew forward, you would have none of these, and people's health would be hugely better.
Okay, and how do parents make sure that their kid's face grows forward enough?
I think that all mothers should study their children at a young age, and as Michael says, try to make them keep their mouths shut. Merely telling a young child to do that helps. I am very happy to start treating children at the age of 4 or 5 if I see they have a severe problem with their posture. A child can be assessed very accurately at the age of 5 or 6 as to how their face is growing. If they see an orthodontist, they can get it measured and assessed and the right prescription advised. But none of this would be necessary if they kept their mouth shut. It's as simple as that.
Can adults reverse?
Well, adults have a problem because the concept of guiding growth is very restricted when the growth is complete. However, the teeth are mobile at any age, and change can occur much older. You may know that if someone gets a stroke at the age of 60 or 70, it can really change the face very substantially. And therefore, we know that if you could do the reverse, you could also change the face substantially, so that any adult